People aged 65 and older reached 55.8 million in 2020, growing nearly 39% in just one decade. And by 2030, every baby boomer will be 65 or older. At the same time, more healthcare is moving into portals, apps, remote monitoring tools, digital records, and virtual communications. The research shows that older adults are adapting more technology, but support and usability still matter. So in one recent study, a summary of 46% of adults age 50 plus said technology helps them lead a healthier lifestyle. And 55% of caregivers said they use at least one form of technology, such as remote monitoring or motion sensors to coordinate care and track health.
So they don't really see what's going on, right? Oftentimes I've been finding that there is a son or daughter that's been abused by that senior, and now they have to take care of them, and that emotional toll it takes on them. So yes, it's vital to work with people in that aspect when you're doing my kind of work.
Technology is powerful, but in senior care, dementia support, and healthcare advocacy, technology cannot work in isolation. It has to be paired with trust, education, compassion, and real human guidance. So for seniors and families, the goal is not just more apps, more portals, more dashboards, more technology. The goal is clarity, safety, dignity, and better care decisions. Welcome to the BetterHealthTech Podcast, where we explore how technology can actually make healthcare smarter, simpler, and more human. I'm Shelby Soto, a marketing and technology professional with over 15 years of experience leading digital growth and product innovation. Today, we're talking about a very important question. Is technology making healthcare easier for seniors and families, or is it creating a new kind of complexity? The senior care conversation is becoming more urgent because the aging population is growing fast in the U.S. People aged 65 and older reached 55.8 million in 2020, growing nearly 39% in just one decade. And by 2030, every baby boomer will be 65 or older. At the same time, more healthcare is moving into portals, apps, remote monitoring tools, digital records, and virtual communications. These tools can be powerful, but only when patients, families, and care teams can actually understand and use them. So the real question is, how do we build healthcare systems and technologies that can support the growing population without making care more complicated? Today, we're joined by Michele Barraco, co-founder and CCO of Compassionate Healthcare Management and Advocacy. Michele is an RN, certified senior advisor, and certified dementia practitioner with deep experience in geriatric care management, transition management, and healthcare advocacy, dementia care, leadership, and strategic planning. In this episode, we're going to explore how senior care has changed, how families and navigating more complex healthcare decisions, and how technology is affecting the healthcare environment, from care coordination and communication to remote monitoring, AI documentation, and patient support. Michele, thank you so much for joining us today. Before we get started, I would just love if you can give us a little bit of a background and share your journey into nursing and how you came to co-founding Compassionate Health.
Well, thank you for having me. So I think the whole journey started back in high school for me. So that was some time ago. I always wanted to pursue nursing. When I was in 11th grade, unfortunately, my mother was struggling with colon cancer. So that kind of solidified my feeling that this is what I needed to do. Unfortunately, she had passed after my graduation from high school. I went into college and I pursued my nursing degree, and I'm a registered professional nurse, and I've been one since 1989, and that sounds like a long time ago. So I started in the hospital system. I was a staff nurse, and I quickly moved into management positions. I was at the same organization for 15 years. I moved into their home care agency for 4 years. So in total, 19 years in the hospital system there. And then what I felt like I needed to come away from the bedside and do something new. So what I did was I pursued care management. So back then I didn't really understand what it was about. But I felt that with my skill set that I've already acquired, that I would try it. So I started in various places. So I worked in managed service organizations, multi-specialty practices, accountable care organization, which was my last job, in the field. So I worked throughout the continuum. Of course, not hitting everything, but I thought that I had a good oversight of healthcare in general, what people have to experience through the continuum. So what I did was, after I was finished I was a manager for care management. And after I had created that role, I hired, people, we went from nothing to 30 people. I had RNs, LPNs, health coaches. It was a great experience for me. When I decided to back out of that, I said, you know what? I built a strong skill set behind me. And I felt that there were so many gaps in the community. And then I felt that I can handle that a one-on-one with people. So I took a huge leap of faith and left that structure and started my own company. Now, in the process of doing that, I had met with a person that I used to work with, a data analyst, actually, which you would think would never connect, right? And he had a vision of doing something just different and meaningful. And then we were just like, we dove right into it. And that's where we created Compassionate Healthcare Management and Advocacy.
That's amazing. I mean, I commend you for one, being an entrepreneur and changing your path, which is, it takes a lot. So
Scary.
Yeah, it's scary. But your story sounds amazing. I can get more into that and have a whole podcast on it. But yeah, that is amazing. So as we get into this, today, families are not just dealing with doctors and appointments. They're also dealing with portals, insurance updates, digital forms, care instructions, medication lists. I can go on, discharge plans and multiple providers. So from your experience, how has healthcare changed for seniors and families over the last few years from what you've seen?
Well, unfortunately, it was almost worse than even 10 years ago. And I think that it's because we are all working in silos, which tends to be a problem. Everybody has their job to do and everybody strives to do that well. Unfortunately, it doesn't reach the community. Now we have home health care that comes into the home. But as far as the day-to-day of what seniors go through with managing their care and their caregivers. So a lot of my clients tend to be caregivers who are trying to manage their life and help and support their loved ones, their aging loved ones. So the disconnect was really from going from facilities like hospitals, going back into the community. And as you may know, you could be a totally different person going in than you are coming out. And you may have many struggles that you need support in the home. So I think that is and remains the biggest gap in care.
Mm-hmm. Yeah. I mean, do you feel that technology has made healthcare easier for families, or has it created more confusion?
So people feel that seniors don't have the capability to use technology, but it is a portal for them to reach out to who they need to. Does it have to get better? Yes. The things that you mentioned are a challenge. I think we need to do better with that. It's a new world for them. Most of my clients are in their late 80s and 90s. Technology is foreign to them. So although I think it helps in some ways, like patient portals, there's not enough education surrounding it.
Mm-hmm. You kind of answered my next question, which is many seniors are not fully comfortable with apps and portals and online forms, digital passwords, just, the whole communication process. Yeah. How big is this digital divide in senior care, in your opinion?
Oh, it's huge. I even see it with myself as an older adult. It seems like we're getting more and more away from picking up the phone and speaking to a person. But now we have to go through a phone tree, and then we have, not a human at the end of it, or we have to go online and fill out paperwork in order to start a process. It is intimidating, and it's time consuming. Mm-hmm. And for seniors, it could be very scary because of the information that has to be provided online.
Mm-hmm. Yes. Just a facts here. So AARP, which stands for American Association of Retired Persons, the research shows that older adults are adapting more technology, but support and usability still matter. Mm-hmm. So in one recent study, a summary of 46% of adults age 50 plus said technology helps them lead a healthier lifestyle. And 55% of caregivers said they use at least one form of technology, such as remote monitoring or motion sensors to coordinate care and track health. So the issue may not be whether seniors and caregivers want technology. The real issue is whether technology is designed around actual life, comfort level, and care needs. So as a certified dementia practitioner, where do you see technology helping dementia care, and where should we be careful?
Well, just with the progression of the disease, when you're speaking of an individual who is living with dementia, as the disease progresses, it could be more challenging, of course, right? Cognitively. For the caregivers, it's time that is spent to do these things. So, but it has good points too, because I have, clients that are living with dementia, and I support the families as well. So it's great to organize and streamline. So for instance, I have a client that I formulated for the nursing assistants in the home that are taking care of the person with dementia, a little bit of education regarding how to approach somebody and distraction techniques and so forth. So I think for purposes of, again, education, of streamlining information so that when we're going to the providers, we could discuss something more in depth, right? And it will help the caregivers organize their thoughts about it, because there's always a lot of questions regarding a condition such as dementia.
Mm-hmm. And this kind of leads into my next question of another major challenge in healthcare is that information is usually scattered between hospitals, primary care doctors, specialists, home care team, rehab centers, pharmacies, families. I'm sure are really familiar with all this. So, how does this affect senior care? You said there should be more on the education part of whether it's using a system or having things all together. But in your opinion, how does this affect the actual senior care?
Oh, tremendously. So for years, just even being in care management, when you have providers. So a lot of seniors have multiple providers. They might have cardiologists and endocrinologists and such. And if they're not in the same system, that information gets lost. So as we go through the care continuum, and that's including when somebody comes home from, say, a rehab or hospital, there's missing information more so than not. So most people don't have their care all in one system. You know, like if they're with Northwell on Long Island and, you know, they pick a provider and another, you know, or an independent provider that is not connected. The interoperability is not there. Don't know how that's ever going to be fixed, but there are a lot of platforms out there, but they don't connect. So for example, for a senior, if they have multiple providers and they are all ordering medication, but they don't know what the other one has ordered, that's a problem, right? The senior is not feeling well, and it could just be medication adjustment, right? Even diagnoses. If one doctor doesn't know what the senior is going through with another doctor, somehow, you know, you're not looking at somebody holistically. So I think that's huge in healthcare, and it's been a problem, and I think it's going to continue to be a struggle.
So there's not any one type of technology that processes all this information. So this doctor can see it, this caregiver can see it. There's not just one portal that you know of. No, that seems so challenging. Especially it seems.
Yeah, I mean, there are in the hospital systems, they do, and if they have owned providers, you know, under their umbrella, they all share that. But once you step out into the community, and you have an independent provider that has a different platform, they're not receiving that information expeditiously. So, because there's a lot of red tape that goes with the dissemination of clinical information because of HIPAA, and then they might not see vital things that they need to, you know, about their own, you know, patient going into the hospital. They might not be able to readily receive that information.
Oh, that just seems like such a huge gap.
It is.
Yeah. And this is why we have these conversations.
Yes.
They're great. So transitions are where small communication gaps can become major issues. A missing medication update, unclear discharge instructions, or delayed follow-up can quickly create risk for the patient and super stressful for the family. So your profile mentions transition management. When a senior moves from a hospital to rehab to a home to assisted living, where do things usually break down in that transition?
Okay, so surprisingly, when I started this business, I knew there was a gap there. I didn't even realize how big the gap was. So what happens is, and as I said in the beginning, everybody has their own tasks to do. When you're in a hospital, those RN care managers, they have their plan, right? As far as safe discharges, rehabs have their own, and so forth. But oftentimes they don't know what's going on in their environment, in the community setting, right? Maybe they don't have family to advocate for them. Maybe the family just hasn't thought of it. So it's really important that they have somebody in the community that could speak to those people in the hospital, rehabs and such, so that individuals can be discharged expeditiously, but also safely. Oftentimes I perform fall prevention assessments in the home, or safety assessments, we call them, so that when they come home, maybe they can't do stairs anymore and they need a chairlift. Maybe they can't get into their bathroom anymore because now they're in a wheelchair. Those kind of things might not be, although the care managers and social workers ask those questions, they're not in the home. So I love doing that because I love connecting with them because I'm giving them information in order for them to create a plan. And then I could follow through with that plan, right? So it's a nice streamlined continuum. So that's a big part of what I do.
Yeah, that's so important. So important. So let's talk a little bit about AI in healthcare. So AI is becoming a major topic in healthcare. From your perspective, where can AI help in senior care and healthcare advocacy?
So in a position like mine, being an RN care manager, it's very helpful for me in order to do research, in order to formulate maybe letters for doctors. Sometimes people need durable medical equipment. If people are going through an appeal, like through Medicaid, they're asking for more hours at home, and they're going for that appeal. The people that are doing the appeal need information. Not only the patient's condition, but why is it necessary for them to have increased care? So through AI, I am able to expedite that and formulate things so that the physicians could review it, add whatever they want, and then this way it could be sent to whoever it needs to be, right? And again, streamlining information for the families. A lot of times, and we probably do it ourselves, we go into a doctor's office, we forget 90% of what they tell us. But if we have our questions there, we don't forget, right? It's almost like a checkoff. Maybe you're having a problem and you haven't spoken to your doctor yet. So in order to remember those things, preparing education materials, big for me. In this way, it's geared towards both the caregiver and the senior so that they understand. So I think that's very helpful to use AI in those instances. Yes.
That's good examples. So sometimes the best technology is not the one with the most features. It's the one that removes friction from the patient, family, care team, and AI can process information quickly, but it cannot fully understand fear, confusion, family dynamics, grief, dignity, everything else that comes on the human side. So in your opinion, how important is that human layer in senior care?
Oh, 100% important. We could use all the technology we want and it's helpful, but that human touch is so important. Families are struggling when they're helping their parent, their loved one, whether it be because of their condition or just they're getting up there in age and they need a little bit more support, right? So a lot of times I find that there's family dynamics. There could be even a son or daughter could be living out of state, so they don't really see what's going on. Right. Oftentimes I've been finding that there is a son or daughter that's been abused by that senior, and now they have to take care of them, and that emotional toll it takes on them. So yes, it's vital to work with people in that aspect when you're doing my kind of work.
But your kind of work is so important. The more we have this conversation, it's even more eye-opening. So as more care moves outside of hospitals into homes, families may become an even bigger part of the care delivery system now. That makes education, communication, and support even more important. So looking ahead, what changes do you expect in senior care over the next 3 to 5 years because of technology?
I think it might be more of a challenge at first. It will all depend on the clinical oversight, in my case, in order for technology and healthcare to work together and not against each other. So I see that there's, people are just starting to get used to newer technology. And in some instances, it's great. It opens up so much for people. But if you don't have that clinical oversight, sometimes there's gaps in that. Right. So it's bringing both of those things together. So I see a struggle. to overcome, like any new thing. And then we have to think, are we rolling it out because we're trying to save money, or are we doing it because it's really going to make an impact for individuals?
Mm-hmm.
Yeah.
My mind is just spinning from a technology perspective and what you do. Like, your role is so important, especially for, the future and people building technology. We need you. We need people like you and companies like yours to help build that technology to, close the gap. So important what you do. But if you had one message or advice to healthcare leaders and technology companies building solutions for senior care, what would it be?
When it comes to healthcare, especially, because that's what I know, I really believe that when a platform is being built, when technology is coming into play, in regards to healthcare, it's very important to have those, let's just say, end users involved in the process, because without it, I don't think it makes much sense to build something without a clinical input to it. So oftentimes I had seen that in the places that I've worked, that we could build a great system and stratification tools and whatnot. And without the underlying clinical piece to it, it really meant nothing. Right. So we have to be, I think that would be the biggest thing that I could say in the creation of new technology for healthcare.
That makes sense. All right. So what we kind of do before closing is something called a rapid fire round. And this is just whatever comes to your mind. It could be a yes, a no, quick answer. So there's no wrong or right answer here. All right. So, one healthcare technology seniors need more to help understand.
Definitely protection of information.
One area where technology helps caregivers the most.
I really do think the same old Zoom, text, FaceTime is very helpful, especially for caregivers that are working, and they could have access to the people they need to.
All right. One mistake families often make when navigating senior care.
The misunderstanding of how the healthcare system works.
One thing AI can do well in senior care.
Again, streamlining information is super important.
One thing AI should never replace.
Oh, human touch by far.
Amen to that.
Yeah.
One word that should define senior care technology.
Supportive.
Ooh, that was good.
Thank you.
Good. Well, Michele, this was incredibly insightful. What I really take away from this conversation is that technology is powerful, but in senior care, dementia support, and healthcare advocacy, technology cannot work in isolation. It has to be paired with trust, education, compassion, and real human guidance. So for seniors and families, the goal is not just more apps, more portals, more dashboards, more technology. The goal is clarity, safety, dignity, and better care decisions. And to everyone listening, if you want real practical conversations around healthcare technology, follow BetterHealthTech on LinkedIn, to watch us on YouTube, listen to us on Spotify, and we'll see you in the next episode. Thank you.